Welcome to COVID Talks. Today I have the pleasure to speak to Dr. Audrey Fontaine. Dr. Fontaine is a resident in psychiatry at the University of Lille. But I'm speaking to her as the chair of the Junior Doctors Networks of the World Medical Association. Hello, Dr. Fontaine.
Hi, Otmar.
Now, tell me a little bit about your personal situation that you have experienced during the past weeks when the pandemic, the COVID-19 pandemic hit France. What have been your experience as a resident in France?
As a resident, I would think that we were not prepared. We haven't been prepared during our medical education to face such a crisis. This doesn't mean that we were not prepared for the specific COVID crisis, but just we were not prepared to shift our workload. So I'm a psychiatry resident. We've tried to diverse a little bit. We used to do face-to-face consults, and now we're doing teleconsultation. E-health, using e-health is not easy, and we haven't been educated for that yet. We have also moved to have some hotline platforms. That's also a new scope of action that we're not used to. Some of my colleagues in my department went to help in other departments, geriatrics, emergency. Some very, very junior doctors could have helped also in ICU units. Some others went to help as other health workers. Some are doing some nurse job or frontline work. And we're not used to do that much. So yeah, we were not ready to face such a shift in our daily work. Also, we were not necessarily that much supported. I mean, junior doctors around the world are facing increased risk of burnout, for instance. We are used to have high workloads. We are used to have very high responsibilities, even though we're not that much prepared to these responsibilities and our skills are not yet that good because we're still junior and very low experience. So we are used to all this. But during the crisis, all this went higher. And during the crisis, as we're doing some things that are out of our scope of action, then it increases the risk of burnout. The other thing that is increased is that we've had seen a lot of support for doctors, nurses, midwives, health workers around the world. Sometimes they include youth, but sometimes not that much, and young people will need even more support in these days of crisis.
Is that also a very psychological stress you are going through? I know the workload is certainly enormous.
Yes, it is. It's psychological in a few ways. So, of course, there is the amount of work that is increasing, that is making us more at risk. But there is also that we have to face some situations that we were not used to. In some countries, ICU units have reached their capacities. So people have had to take some decisions, on how to triage people coming in ICU. Because of the enormous amount of work, there were some situations where junior doctors had to be involved in these decisions. And this is something really hard to take for a fully experienced doctor, but it's even harder to take the lower experience we have. And also the other kind of psychological issue that junior doctors, maybe even more than other doctors, are facing is that at the beginning of the crisis, we were in a phase where we would need people to get involved in the fight, but also we would also need some other people to kind of step back or be as a second line. In psychiatry, for instance, I could see a lot of my colleagues in my department wanting to do things, and we were kind of frustrated because you're like, I want to help, I want to do something right now, but also if you work too fast and then you expose yourself to exhaustion, you will not be able to give the specific care that our patients, for instance, in psychiatry will need, or we won't be able to cover the post-crisis issues such as depression, anxiety that we're going to see over the next months after all the confinement and quarantine will go off.
We have seen in many parts of the world that there was a shortage of supplies of personal protective equipment, whether that was masks, gowns, glasses. Is that something junior doctors have experienced as well?
Yes, they have experienced it as well. And the issue is even worse for junior doctors because, well, we are doctors, but we're not yet senior doctors. So sometimes we have seen situations where the equipment would go to the official, people in charge, and junior doctors will be less provided with this kind of PPIs and things like that. And that's something, of course, that is not acceptable.
Have you seen discussions about whether it is ethical also to deny treatment when you don't have protective equipment? I know that there has been a situation, or have been situations, where doctors really were frightened in going to these COVID situations where they had absolutely no protection. And I think they raised the question, where should I go in there, and should by that I endanger myself, endanger also my family and other patients with that? Have those discussions been going on as well?
Yes, they are. And it also links to the psychological issues that we were discussing earlier. It brings some more burden to the junior doctors. Some junior doctors have been tested positive to COVID, for instance, and they were in this situation where they knew they were having symptoms, or they knew they were positive to COVID, but they also had to deliver care. And then they were sent home, and then they were like, oh my God, maybe I contaminated a lot of people. Maybe I exposed my family. And this is something that is really hard to deal with as a doctor, because we are here to save people's life. We're not here to endanger them. And because of a situation that does not really depend on doctors, but still we are endangering people.
Now, for you as a junior doctor, have there been positive experiences with this COVID crisis? Have there been learnings which you would say were really helpful, or experiences with other people, with colleagues or with patients, which have been gratifying or positive?
Yes, we've had some very good experiences. One of them, I would say, is global cooperation. Earlier, I mentioned some of my colleagues going to help out nurses and to kind of cross some borders that we have amongst health professionals. And I think it's very good that we reach out to each other and that we build up a health workers community. And it's not only doctors on one side, nurses on the other side, midwives on a third side, and so on. So it's very global. So we, as Junior Doctor Network, have been also discussing with other young youth professional associations. And that was a very good thing that we could see from the crisis. And what we can also see is that cooperation not only within the health system is important, but cooperation globally is important. The crisis that we are seeing now, it's not only a health crisis. Everybody is saying, oh, it's a global health crisis. Well, it is a global crisis. It's not only health, it's diplomatic, it's economic, it's business. Every part of the world will have consequences from this crisis, and we need everybody to work together, and we shouldn't see some position as we are just all go back on ourselves and just close up and don't discuss, because that's the way we're going to have the most issues.
Now, you as a junior doctor, you have a good chance to see something similar occurring again during your work life. What do you think are the learnings where we all have to change and have to make a difference in the future in healthcare and maybe in society in general?
Well, we have to change a lot. Basically, we do have to change a bit the healthcare system. We have seen that there were issues in the chain of supplies. We have been lacking PPI. There are issues in the workforce, because we have briefly mentioned it, but there are some places where the workforce is very low. We have migrations of workforce to other countries, resulting in some countries having no one to be able to treat their own patients. We have also issues with doctor facing burnout, but if a doctor is sad or is not competent to work, then they cannot provide any healthcare. So first, we have to rethink about how healthcare is organized. But as I mentioned earlier, we also have to think about the other systems. Global cooperation, global connectivity. We have seen, back to the PPI things, but trade disruptions have led to the situations that we have now with lack of PPI. So it's definitely not only health, it's global. So to make sure that if this situation happens again, we are prepared, then we first have to change our system to make sure we think global. And for medical students and for health system precisely, we also have to change the way how medical education is done. Because I started with this. We were not prepared to this kind of shift in our work. We were not prepared to be resilient. And that's something that we need to learn among all the other things that we have to learn in medical schools. But that's something that is very important.
Dr. Fontaine, I thank you for taking the time and for this very interesting talk.
Thank you very much, Otmar.